Hey guys, welcome back to Defeating Hair Loss. My name is Steve. Tonight we're going to talk about hair transplant surgery shock loss. The actual name was severe shock loss, but in my world, it's all severe. I don't want any shock loss. So let's talk about it. When you have a hair transplant, we want to be very careful both in the recipient area and in the donor zone. Start with the recipient area. I'm not a big fan of going in between the hairs that are already there. Hair transplantation, in my opinion, is not for diffuse thinning. It's not for thinning. It's for balding. We want to put hair where you don't have it. If you have hair in a zone and you want to put hair transplants in there, you should plan on that hair shocking out, although it probably won't. So what I mean by that is that if it's weak hair, if it's thinning hair, and you get shock loss, you should expect that and plan for that. That way you're not disappointed. Severe shock loss could mean that all the hair anywhere near that hair transplant is going to fall out. Most of the time, it'll come back. So your expectations are that it's going to take time. It takes a long time. It's actually referred to as telogen effluvium. When that hair will just kind of go to sleep, those follicles will give up their blood supply to feed those new wounds that have been kind of marked on your scalp. That's the reason for the telogen effluvium or the shock loss. However, most of the time it comes back, but I never say never. So we want to be very careful. We don't want to think we can just go in between the hairs. That's why female patients who generally have female patterns, which is a diffuse thinning, are not good candidates for hair surgery. The donor zone, that's up for grabs as well. We want to be very careful with an FUT procedure that you haven't had multiple FUT procedures over the course of your life, like me. I've had a lot of small FUT procedures, and my last procedure in my hairline, which changed my life, didn't change my life because it was FUE, but I didn't want to take a risk, nor did my doctor, my surgeon, Dr. McGrath, want to take a risk that I could have a problem closing the wound and causing hair shock when that skin is pulled together. When that happens, the hair above the scar line, the suture line, and the hair below the suture line will fall out. It'll go into that same telogen effluvium. And depending on how tight it is to close, it'll take a heck of a long time to come back, and that will not be comfortable. So let's avoid those situations. And don't forget to reach out to me in case you think you're in that situation. So the expectations of hair shock is about 20% of the patients, these are just anecdotal numbers, will have some sort of shedding if you go into an existing zone with hair. But mostly all the time, I would say as high as 85% of them will all regrow that hair back. It just takes time. Here's a tip. Preventative treatments. What can you do? What are things you can do to avoid hair shock? Number one, beyond that combination medication of finasteride and minoxidil for a few months prior to your surgery. That's number one. Number two, the laser treatments. Lasers are good. They bring blood flow to the follicle. That's what we just talked about. You're going to be getting rid of that blood flow, at least in certain areas. The laser will work better, and it'll work on the mitochondria, which is the cellular structure of the follicle. Pay close attention to your pre-op instructions, the compliance. I'm a compliant patient. No matter what kind of procedure I'm ever gonna have or had, I go by the rules because you got nobody to blame for yourself if something happens. And then, of course, your post-op. And this is where it gets a little dicey. When it comes to hair washing, when it comes to taking care of it, when it comes to staying away from, activity and all that stuff until the suture comes out, that's what you're gonna do. But if you go back to that gym and you lift too heavy, too soon, too fast, you can get a little stretchiness, a little bit of shock loss around that suture line as well. Now, I'm not saying stay out of the gym like some of these places, these forums online, they'll tell you to stay out of the gym for 5 months. That's insane. You gotta go back to the gym. But just go back with a little bit of lighter weight and introduce your body back into it, especially where those muscles and those nerves are all tied together. From your shoulders, your traps, your neck muscles. You want to kind of take it slow when you come back so you don't have any issues in that donor zone. Hey, I hope this helps with some of these tips. Shock loss is not fun. In case you do suffer from that, we're always here to help. Don't forget to like and subscribe.